you for joining us today. The goal of this series is to provide all those whose lives have been affected by cancer with the tools and resources to live well beyond cancer. The team at ReVital want to enable you to do the things that are important to you. Things like going for a walk, eating the food you enjoy, performing everyday activities without pain, and returning to or continuing to work. Our therapists are trained to help you identify and achieve the goals that are specific to you. It is my honor to introduce today's presenter, Katie Hutzaluk. Katie is a 2006 graduate from the University of Scranton, having received a master's degree in occupational therapy with a concentration in human development and a minor in psychology. Katie has over 16 years experience working with adults in various rehab settings. For the past 12 years, Katie has focused on outpatient rehabilitation with patients dealing with neurological, oncology-related, and lymphedema-related deficits. She has been with Kessler Rehab since 2017. A Piscataway native, Katie currently lives in Bridgewater with her husband and 2 children. When she is not working, she loves spending time with her family and friends, watching HGTV, and traveling to Cape May. Thank you, Katie, for joining us today. We're going to play our video shortly, and everybody will have an opportunity to ask Katie questions live by putting those in the Q&A box. These cannot be viewed by other participants, but only by the panel running today's presentation. If we are not able to get to your question, we will reach out via email by the end of the week and answer your specific question. A reminder, this material is not intended to represent methods and/or procedures available for the medical conditions discussed. It is only intended to present an approach, view, statement, or opinion of the presenter, which may be helpful or of interest to patients, caregivers, or practitioners. Under no circumstances is the information provided to serve as medical advice. Before we close, we'll review upcoming topics and let you know how you can find a cancer rehab specialist close to you. So now we're going to go ahead and play Katie's wonderful presentation regarding lymphedema.
Welcome to the Living Well Beyond Cancer Survivor Series. Today's topic is taking control of lymphedema. Thank you for joining us today. My name is Katie Hutzaluk, and I'm a board-certified occupational therapist, having completed my master's degree from the University of Scranton in 2006. I've worked in various adult settings over the last 16 years for many large health and rehabilitation facilities throughout central and northern New Jersey. My most recent tenure is at Kessler Rehabilitation Center, where I work as an occupational therapist clinical specialist, ReVital cancer rehab specialist. I completed my specialization training in lymphedema in 2018 through the Norton School. I am passionate about assisting patients going through cancer and beyond achieve their goals and find their greatest fulfillment. I'm excited to speak to you today about lymphedema and my role in assisting individuals experiencing cancer-related lymphedema. In this session of Living Well Beyond Cancer, I will walk you through what is lymphedema, the risk factors associated with cancer-related lymphedema, talk about strategies to help reduce your risk of developing lymphedema, and when to seek support from a cancer rehab or lymphedema specialist. Cancer is a journey, and we recognize not everyone's path is the same. Everyone starts in a different place. Your age, your beliefs, your support system of family and friends, your general health or well-being, among other factors that contribute to where you are at the beginning. Also, your destination may be different. Where are you going? Is your destination finishing treatment and putting cancer behind you? Or is it living with a chronic condition, managing side effects to lead as normal and independent life as possible? Your destination is determined by the goal set between you and your medical team. Once diagnosed with cancer, your path may take you through different treatment choices: surgery, chemotherapy, targeted therapy, radiation are all customized by your cancer care team to meet your needs and to get you to your destination. Before we talk about lymphedema, which is a dysfunction in our lymphatic system, we first need to understand a little bit about the lymphatic system. We are all born with a lymphatic system. It is vital to our immune system. It allows us to fight infections by ridding our bodies of toxins and promotes fluid balance in our tissues. But how does it do it? The human body is composed of two circulatory systems. One that carries the blood through the body in a circular fashion, from the heart to the arteries, to the capillaries, to the vein, and then back to the heart. The lymphatic system carries the protein-rich lymphatic fluid. It is responsible for returning the fluid out of our tissues and back to the heart. Once this fluid is returned to the heart, and then moves on to our kidneys, and then is removed through our urine. The lymphatic system is throughout our body and is both on the surface and then deep within our organs. The surface, or more superficial system, is divided into territories or regions. These regions have divisional lines known as watersheds, down the midline and around your abdomen at the level of your belly button. When your body moves fluid through the superficial system, it doesn't normally cross or therefore stays within an area of lymph nodes that help filter those toxins, waste, and unneeded material. This is why when lymph nodes are removed, we know which part of the body to monitor for changes. For example, a person with breast cancer and has lymph nodes removed from the right armpit, we monitor their right chest, back, and arm for changes in swelling. So what is cancer-related lymphedema? An accumulation of fluid and fibroadipose tissue due to destruction of lymphatic flow from cancer and its treatment. Let's break that down. An accumulation is a buildup of more fluid in areas than is typically there. Lymphatic fluid is thicker than water. The toxins, waste, and unneeded material clump together over time, creating fibroadipose tissue. Fibro, as in fibers, cause a thick network, and adipose, meaning fat. This makes it more difficult for the lymph fluid to move into the vessels through circulation and back to the heart. When a person undergoes cancer treatments, they can have a change to their lymphatic system through surgery or radiation, making it more difficult for the body to move lymphatic fluid. These factors, along with obesity, injury, and infection, can result in a destruction or reduced movement of lymphatic fluid, allowing it to build in the tissue as you see in this person's arm and leg. It is important to know that this doesn't happen overnight. Small changes in the lymphatic system function build with time. If you experience a sudden change in swelling, you should contact your doctor immediately, as this is not indicative of lymphedema and may require more immediate medical attention. It is important to remember not all swelling equals lymphedema. You can have edema or swelling related to venous system problems, water retention, arthritis, organ problems such as your heart or your kidney, medication, lipedema, or an injury like an ankle sprain. Many think of breast cancer when they think of lymphedema, but it really occurs with any diagnosis in which the lymphatic system has been impacted. Additional cancers that it's more common to see lymphedema as a side effect include melanoma, bladder, sarcoma, uterine, head and neck, cervical, vulvar, and prostate. These types of cancers have some commonalities in their treatment that make patients at risk for developing lymphedema. These are known as risk factors. There are 4 major risk factors for developing cancer-related lymphedema. 2 related to cancer treatment include removing or damaging lymph nodes through radiation and chemotherapy. These cannot be avoided. Risk factors such as maintaining a healthy weight, such as a BMI less than 25, and working with a cancer rehab therapist or specialized exercise physiologist on a comprehensive dose exercise program, including aerobic, stretching, and strengthening components, are excellent ways to reduce immediate and long-term risks for developing lymphedema. Although infection and injury cannot necessarily be avoided, there should be an extra caution if these events should arise. So what might you notice? Changes in fit of your clothing, shoes, or jewelry. You may feel that a part of your body is visibly larger than normal. Tightness in your joints or stiffness with movement. Puffiness or feelings of fullness. Changes in skin texture. And sensory changes such as burning or itchiness. Working with individuals who may be experiencing stage 0 and stage 1 lymphedema is generally considered to be the most ideal, as they are most likely to see their symptoms reversed. We typically think of stage 0 as subclinical. Despite not a lot of outward signs of lymphedema, the lymphatic system is impaired and subtle changes can be occurring. These individuals may start to notice heaviness or achiness. Stage 1 is where swelling is typically first observed. This swelling may not contribute to an overall volume change when comparing to the opposite side, but the individual may feel the swelling improve with rest and elevation. The American Physical Therapy Association, Academy of Oncology PT, looked at all the research related to breast cancer-related lymphedema and found that early identification of subclinical lymphedema in high-risk groups have better outcomes. This is best done through prospective surveillance or planned scheduled visits with a healthcare provider during the first few years of the cancer journey. While lymphedema can develop at any time throughout your lifetime, it is more common to develop during the first 3 years following cancer treatment. This is why the prospective surveillance model is recommended during those years. Other treatments include education to know risk reduction strategies, be able to perform self-massage, wear compression garments if determined appropriate for you. Lastly, one of the most effective ways to treat all stages of lymphedema is exercise. Exercise, both aerobic and strength training, are beneficial to reduce the risk of developing lymphedema and decrease the impact lymphedema has on your daily life. You should start with weights that are low and progress slow. A cancer rehab therapist is a great person to help you establish an exercise program. Here you see a picture of a person with lower body stage 1 lymphedema and a person with stage 1 upper body lymphedema. It is important to know it can be in the whole limb or just a part. You can see the person's arm is more involved than her hand. It also can be the reverse, just in the hand and not in the arm or in the chest or back. If early signs or symptoms of lymphedema are noted, the person should be individually fitted with a compression garment, instructed in exercise, and provided education. If you are experiencing signs and symptoms of stage 1 lymphedema, seek care from a specialist soon to reduce risk of further development. Exercise as prescribed and monitored by a therapist can be beneficial as you go through or even after cancer treatment. Exercise allows your muscles to act like a pump and drain any excess lymph fluid. It is a myth that exercise and strength training increase the risk of developing lymphedema, but rather it allows for improved range of motion after surgery, improved overall strength, and weight management, all of which are contributing factors to have a positive impact on lymphedema risk reduction. For more information on the benefits of exercise throughout the cancer journey, please check out our previously recorded series on exercise through the Living Beyond Cancer website. With stage 2 lymphedema, this is the beginning of advanced chronic lymphedema. Swelling is now consistent and the tissue may be changing in texture and notably, progressively getting worse. This requires a more extensive treatment plan to manage both acutely and long-term. This type of treatment is called complete decongestive therapy, or CDT. We will talk about that shortly. Stage 3 is progressive disease with tissue thickening, presence of skin folds or lobules, color changes, and skin texture changes with funky growths. The key with stage 3 is now that you having both a lymphatic disease, but also a disease of your skin as well. Both of these stages are chronic, worsening long-term conditions that require daily management. If you are experiencing signs or symptoms of advanced lymphedema, consult your physician and seek treatment with a certified lymphedema therapist. Let's take a look at these pictures. You can see these limbs are quite a bit larger. We also see the other changes in the color, limb shape, and deformities. How does this impact this woman's function? If we zoom our eyes onto the woman on the far right, you can see her left leg is much larger than her right. This can impact her joints, her ability to walk, her ability to change her position, her ability to get dressed. At the time of this picture, she had lymphedema for 40 years. It had started in her early 20s. She's an occupational therapist that works in pediatrics. So you can imagine running, walking, catching up to kids, holding kids, sitting on the floor, getting off and on the floor are all very difficult. She has adapted to life with advanced lymphedema well, but still requires daily self-treatment to keep her limb healthy and active. Treatment for stage 2 and 3 lymphedema is known as CDT, or complete decongestive therapy. It should be performed by a certified lymphedema therapist, or CLT for short, to ensure proper use of manual lymph drainage and compression bandages. Manual lymph drainage is a light touch massage that moves lymphatic fluid from impaired areas of the body towards non-impacted areas of the body. Skincare is important to ensure skin is clean and free of potential infection and/or breakdown. Generally, alcohol-free lotion is applied to the skin to ensure hydration. Multi-layer bandaging using short stretch bandages, cotton, and foam are used to promote limb size reduction and allow for lymphatic flow. Not all cancer rehab therapists treat advanced stages of lymphedema, but all are able to help assess and refer you to the right person for your symptoms and stage. In more advanced stages of lymphedema, there are now newer surgical options including lymph vein bypass, liposuction, and lymph node transfers. These surgeries are performed by specialized trained surgeon, and you would need to be assessed as a candidate for each surgery type. I've mentioned education as an important part of all stages of lymphedema. An important part of education is knowing and using risk reduction practices. Step 1 is early detection. Be aware of early signs and symptoms. One of the best ways of doing this is seeing a cancer rehab specialist before you have surgery, chemotherapy, and/or radiation. They can take baseline measurements and monitor for changes. If you are past this phase in your cancer journey, it is never too late to get measured and monitor for changes over time. Step 2 is having good skincare. This reduces your risk of developing an infection. If you get a scratch, cut, or injury to the area, clean it immediately and cover with a bandage to avoid infection. Wearing gloves, long sleeves, and pants while gardening. Wearing bug spray and sunscreen are also good practices to help protect your skin outdoors. Keeping your nails clean and trim, applying lotion to avoid cracks in your skin is useful. Step 3, maintain a healthy weight. Higher body mass index over 25 is a risk factor for developing lymphedema. Keeping an active lifestyle and a normal weight are critical. Step 4 is exercise. I've talked a lot about exercise today. Remember, it can help reduce the severity and help reduce your risk of developing lymphedema. Step 5, wear a compression garment if determined appropriate by your healthcare team. This should be determined only after assessing your risk and stage of lymphedema. And step 6, regular medical checkups. Reporting any changes in at-risk areas to your cancer team. This will allow for early detection and early treatment if you develop lymphatic swelling. It is important to note that research indicates that there's no greater risk in developing lymphedema as a result of air travel, blood pressure readings, blood draws, and exercise using heavier weights. I recommend talking to your healthcare providers more about this. Now that you know more about the lymphatic system, cancer-related lymphedema, and treatment, When should you seek care from a cancer rehab therapist? Anytime. Therapists can evaluate your risk, help you build a specific exercise plan, and help you create healthy habits. You should seek care soon if you are experiencing any feelings of heaviness, achiness, fullness in an affected area, stiffness or decreased flexibility of your joints, clothing and jewelry that's fitting tighter, or any persistent swelling after surgery that's lasting greater than 6 to 8 weeks. Early diagnosis and treatment is more effective for reducing the impact of swelling on your daily life. We hope you enjoyed this presentation of Living Well Beyond Cancer, Take Control of Lymphedema. I thank you so very much for your time today. It is such a gift we can give one another, and I'm grateful you shared some of your time with me. You can learn more about ReVital Cancer Rehab on our website, revitalcancerrehab.com. There are ReVital cancer rehabilitation programs across the country composed of licensed physical therapists, occupational therapists, and speech-language pathologists who are also certified cancer rehabilitation therapists. Each is able to take a detailed history and accurately evaluate your individualized cancer rehabilitation needs before, during, and after your cancer treatment. Our mission is to make cancer rehabilitation the standard of care for anyone affected by cancer to allow you to live your best life. And I could not have completed this presentation without the help of the amazing researchers and clinicians throughout the country. Here are references for this presentation.
Thank you, Katie. That was very informative. And full disclosure, I am a certified lymphedema therapist myself. We have the questions coming in, so I just thought we'd get straight away started with them. Our first question is, you said exercise helps with lymphedema, and we say it all the time, but somebody's wanting to know, can you explain a little more and maybe speak to those that don't want to go to the gym? What would an exercise program look like for some of these people?
That's a great question. So with exercise, especially when you have lymphedema, we think of our lymphatic system. And one thing about it is that it's just under the skin. So when we have the opportunity to exercise, especially like a repetition exercise, maybe we're doing arm weights or we're just moving in general. Each time we move, we really pump that lymphatic system, which allows it to flow. And when we allow it to flow, it really promotes the drainage. So, exercise can be very beneficial in that sense. Now, with that being said, if you are someone that has lymphedema, we do encourage you to exercise with well-fitting garments or with compression bandages as to prevent any excess of fluid, but it really does allow that lymphatic fluid to really flow and to drain. Also, it's just good in general. It just really promotes our overall health and well-being, helps to, help us to feel stronger, help us to have more range of motion, and really also just reduce any fatigue that you may be going through.
Yeah, it really is the treatment that can address many of the ailments associated with cancer treatment, right? Fatigue, neuropathy, cognitive deficits, and obviously lymphedema. Sometimes I even tell my patients, because they might not want to go to a gym, but they enjoy walking. And I think another one is if you enjoy the pool, it is a great place for lymphedema patients, because of the extra pressure that the water provides, as well as taking off the extra weight of being on land. So exercise is hugely important. And if just starting walking or something like that is hard for you, this is absolutely when a cancer rehab specialist can become involved. We have another question. Regular checkups with what person? Lymph therapist or oncologist, Katie?
So that's a great question. Honestly, in this situation with cancer-related lymphedema, it is really important to meet with your oncologist as they indicate. whether they want to see you every couple of weeks, every 3 months, every 6 months, that's really largely important. But if you're someone who is at risk for lymphedema or showing some soft signs for early stages, I would recommend getting connected with a local certified lymphedema therapist, whether that's an occupational therapist or physical therapist. That way you can get started with having some basic measurements done, as well as some really specific education to your particular situation, and any intervention that may be appropriate just for you. So again, we do recommend that you follow up with your medical oncologist, as that's largely important in managing your disease process. But it is good to meet a local therapist in the area.
Right, because you spoke frequently about prospective surveillance, and maybe speak a little to what that is for those that have not heard that word until today's presentation.
Sure. So with prospective surveillance, I generally meet with patients, and usually this happens fairly early in their cancer journey, but it could also start at any point. And what I like to do is just kind of assess where the individual is at, but we specifically look, depending on the type of cancer, on whether if they have breast cancer, I may assess their upper extremities or their arms, or if they have prostate cancer, I may look down at their legs. And I like to take volume measurements. So I use my tape measure and I measure the leg every 4 centimeters or the arm every 4 centimeters, and I calculate a lymph volume. And what I'm trying to do is just make sure that side to side is fairly equal. And if I'm noticing any changes in skin or, any other ailments, sometimes people have some stiffness in a joint or weakness in a muscle, then I'm there to make sure that I can intervene and help that person, whatever their needs may be.
Right. So then once we have those baseline measurements and we've done education on the importance of exercise and skincare, and all the aspects of lymphedema therapy, then the patient can, reach out to us, right? If they start to notice the lymph feels heavy at night or achy, or it's itching more, or their jaw is not fitting, they have an expert that can support them with that. Next question. Which food and medications can cause increased lymphatic load?
Okay, that's a great question. So when we think of lymphedema, we think of swelling, and when we think of swelling, we think of water and volume. And what's interesting about lymphedema, lymphatic fluid is a little bit different than if I, fell and sprained my ankle. Lymphatic fluid contains a lot of proteins, and it can actually be very dehydrating to the body. So in terms of food to avoid, it's interesting, a lot of times we think of like having a lot of salt and, fluid retention, and it's not necessarily applicable here. Although we would recommend you keep a healthy diet of good balanced food, as well as really making sure that you stay hydrated. I wouldn't say that there's going to be any particular food or necessarily a medication that would increase the lymphatic load. But with that being said, I know that there are certain chemotherapy agents that may increase fluid volume. So that may be a question when you're taking certain medications, especially oncologic medications, a good discussion with your doctor about that.
Yeah. And I think I have had this, and you may or may not have, Katie, but I have had patients think because they have lymphedema, they need to drink less water.
100%.
And that is not how it needs to go, people. When you have lymphedema, or regardless, you need to be drinking the amount of water recommended by your treatment team. So I think that's a really important part of that equation. Okay, we've got lots of questions coming in, so let me just grab the next one. I'm wearing compression as directed by my physical therapist who's trained in lymphedema. But wearing them makes my fingers swell even more to the point it impacts function. Does this mean the garments are not correct for lymphedema?
So with that being said, I'm sure the garment is correct in terms of what they recommended for you, but you may just need to have it refitted. I'm not sure
Right.
if it's a custom garment or if it's an off-the-shelf garment. The garment itself should not make your swelling worse, and it also shouldn't increase, symptoms of numbness. So I would definitely highly encourage you to go back to that therapist and just let them know that. Whether they have a garment fitter come back out and just help remeasure that, or just maybe recommend a different type for you. Because again, we wouldn't want you to lose function or make your swelling worse.
Right. And, just to speak a little to that, to those watching, there are off the shelf garments that you can even buy on Amazon these days, and there are custom garments. There are also varying levels of compression, and that is all part of your certification when you become a lymphedema specialist. And Katie, have you had patients who've never seen a therapist come in and bring you everything they bought on Amazon, trying to address what was going on with them? It's pretty common. People just keep buying things. I encourage you to see a specialist who can make sure. I think one of the other things is the garments need to be replaced frequently. Correct, Katie?
I agree. I generally recommend that the garment should be replaced every 6 months, sometimes sooner, just depending on the wear. Especially someone who's wearing the garment consistently, it is going to show signs of wear, and over time, it's not going to have the same effect. So we definitely recommend that you be mindful of having them replaced. Sometimes the garments have a little tag on the inside, so I always tell people when you start to wear the garment, maybe you take a Sharpie and just write the date just as a reminder to yourself. Or if it comes in a little box, I always say save the box and just write the date that you started with it. So that way it's a good reminder. And oftentimes I have people like build into their calendar, whether they like to write it down or if they use their phone, like a little reminder, like, order new garment or come see Katie so that we can look at new garments or whatever it needs to be done. Just because so often I've gotten patients where they've been treated really successfully for lymphedema, and then they'll come in and say, well, it's gotten worse. And then the first question I ask is, well, how old is your garment? And they tell me 5 years, 10 years. And, it's time.
Yeah, I had someone recently, Katie, who was treated in the 90s when, mastectomies were different and they took all your lymph nodes, and has worn a garment since then, which has not been refitted. Now it's replaced frequently, but it's the same high level compression. No one has refitted it. And then she decided, well, if I haven't had lymphedema for 20 years, I'm going to stop wearing it. And we learned the hard way. So it was a reminder to her, and she's dealt with this for 30 years. So it is important. Another aspect of lymphedema specialists is dealing with the garments. They tend to be expensive, and we can discuss insurance. It's specific insurance, right, Katie, whether they're covered or not.
Yeah. And everybody's different with their insurance. Some insurances are great and they have good coverage and they'll be very supportive with garments. But other insurances, even Medicare at this time, that don't cover it. So it can become a financial hardship. And there are avenues and resources to help people obtain garments, but it's a lot of paperwork. It's a lot involved with it. So I can appreciate where people get discouraged pretty quickly. I will say Congress has passed the Lymphedema Treatment Act, so hopefully we'll be seeing some positive changes in terms of how garments and lymphedema supplies are covered, but more to come on that because they haven't exactly laid it out for us as therapists to understand as of yet.
Right. It's a recent change, but we haven't seen it hit the treatment zone yet, have we? Next question. I have been doing exercises, massages prescribed by my PT specialists since 1 month prior to my lumpectomy and sentinel node removal 6 months ago. I have no symptoms of lymphedema so far. If going on a long cross-country plane trip, should I be measured for and purchase a sleeve prior to the trip to be worn as a preventative measure?
That's a great question. And for many years, it was recommended that patients at risk for lymphedema, and specifically, I'll just tie this into breast cancer that, don't have your blood pressure taken in that arm, don't have blood taken from that arm. If you go on a plane trip, wear a sleeve. But more recent research that's come out and guidelines have indicated that these concerns are not necessarily founded. And from my personal experience of working with my patients, that just becomes a personal choice. Some people feel more comfortable having it, and some people are okay without it. So at that point, I would recommend maybe just running it through your medical oncologist or your treatment team. But again, more recent guidelines and information have indicated that, previous recommendations to use the sleeves have not necessarily been founded either way to prevent lymphedema.
I think one part, Katie, that I often discuss with patients, especially in the early stages, is that if you fly and you notice an increase in, fluid in your arm or symptoms, then you have your answer, right? It's not likely in that early stage. Again, it's a treatment team discussion, but it's not likely to be irreversible in the early stages. So if we fly and we do notice some symptoms or your rings are tight, now we all swell a little when we're in the air, depending how far you're flying anyway, then then you have the opportunity and you have more information. But it is a personal choice. And some patients I have wear their sleeves just when exercising, flying, and gardening, and otherwise they're fine. Again, it's all very individual, and that's what a specialist, a lymphedema specialist, can help. Okay, here we go. We have a sort of blended question here. Exercise. I have lymphedema in my arm, planks and downward dogs. Okay. Any recommended exercises to avoid, or order in which I should be doing these to help decrease my swelling? If I do my typical aerobic workout, which starts with running and jumping jacks, this greatly increases my swelling in my breast almost immediately.
Okay. Well, this is a great question, and you're combining several different types of exercise here, which is good. But I guess what I would recommend with this, if you do have lymphedema and potentially lymphedema in your breast, before you start, I definitely recommend, if you're not already, to be using compression. A lot of times we think of compression, we think of arm sleeves, or we'll think of like stockings for the legs. But even if you're noticing that you're getting swelling into your breast, you may want to talk to your doctor or even local therapist about getting a compression bra if it's appropriate, just to provide more support. And then in terms of the exercise, I always recommend, starting with a good warm up in terms of stretching, and then moving into a light aerobic exercise, as well as then going into some strength training. Weight bearing exercises like the planks are very good in terms of helping to build strength, and as well as, increase our nerve sense. But yeah, no, I would definitely just be concerned that you have enough support prior to your exercise. We wouldn't necessarily want to see an increase in swelling as a direct result of the exercise.
I also, compression bras. I have a few patients now, Katie, also using compression tanks for the lateral trunk under the arm that might be not always encompassed in a bra. But again, if you speak to a specialist, they can help you problem solve that, right? And figure out what's going on and keep you exercising. Okay. Next question. I have a large lymphedema massage machine, with vest and shorts, which was prescribed. It does not seem to help. Do you recommend these machines?
This is a great question, because there are a lot of options on the market. It seems like you do have a great machine, because it encompasses different areas in the lymphatic system to create a good flow. Some people feel that they do give good results, and others maybe not as much. I do think that they have their place, especially in individuals that may have more chronic lymphedema and swelling. The goal of the machine is to help with manual lymph drainage and just overall limb reduction. But if you don't feel it's helping, you may want to contact well, the person that recommended it to you, but also the vendor that provided it. I don't know if it needs to be adjusted, if there's different settings that could be used. I don't know, Kirsty, if you've had this experience as well.
I have, yeah, and I'm unsure. It sounds possibly like the Flexi Touch compression pump. There's some other options. That is the pump that Lana recommends. And even with that, I have had patients who will say, I don't think it's working. Often if I get the vendor back in, it's some adjustments in the pump. Every now and then I have someone who, no matter what we do, I don't think they benefit. Overall, I would say the majority of my patients benefit. And it's usually a combination between the oncologist and myself and the patient, and then dealing with the insurance company. So I think contact your vendor and just make sure, just like with a compression sleeve, sometimes they do have different settings. So it might be that your presentation has changed slightly, and that they can adjust it so you can benefit more. Next question. Did I hear you say that getting blood draws and blood pressure is okay on the arm with lymphedema?
So, with that being said, it really, I would talk to your doctor first. Previously it was a hard no, and now I would say it's more of a soft no. I mean, if you can avoid it, I probably would encourage you, especially with frequent blood draws or frequent blood pressure, to avoid the arm that's involved. But again, more recent guidelines have kind of shown actually to be positive, that it does not necessarily cause a worsening of the lymphedema.
I mean, sometimes it cannot be avoided, right, Katie? Depending what we've got going on. And I'm exactly the same. If it's an option to avoid it, great. But sometimes, and research has changed, but it was a hard no back when I did my training, and I'm not going to say when that was. Okay, next question. How can you prevent protein buildup in the lymph fluid and during lymphatic drainage massage? Do you excrete the fluid through urine?
This is a great question. So, with the lymphatic fluid, it is comprised of protein, and in terms of preventing the buildup, that's a little bit more challenging. And I think Kirsty may agree. When you're starting to have insufficiency, or your lymphatic system isn't working quite as well, it's a little bit unavoidable. The thing that you can control is how you have it addressed. And in terms of the way the massage works, yes, we push the fluid towards more intact areas to promote the drainage, and then eventually it does come out through our urine. So I do find that my patients, especially after the massage, have to go to the bathroom more frequently, or when they're wrapped, they feel initially that they have to use the bathroom a little bit more frequently.
Right.
I don't know if you have anything else to add.
100%. Now I would say, seeing again a lymphedema specialist helps with the reduction of the localized protein buildup by reducing that limb. But yes, we move it. I like to say it's an interstate, and if there's a wreck in one region, we move the traffic elsewhere, and then eventually it will come out in the bathroom. So I do warn my patients of that too. Next question. When can you wear your lower limb garment after hip replacement surgery? No bending beyond 90 degrees. Not sure for how long. That's a great OT question.
So getting that garment on will certainly be challenging with hip precautions. You may initially require someone else to assist with that. Although I have had some great success with using some donning type devices. Really, I would talk to your surgeon about your condition and about the garment. Generally, after surgery, we always have a little bit of what we refer to as post-operative swelling. So wearing compression can be very beneficial. So with that being said, as long as the surgeon's okay, I mean, it'd be good to put it on sooner rather than later. It's just a matter of maybe adapting how you're doing it. Um, sometimes people use long-handled reachers or socket type devices, or, depending on the situation, you may just need a second person to make that safe for you.
Yeah. And if that wasn't an option and things covered, you may be able to consider a Velcro garment, but you've still got to get your foot in that garment. So definitely problem solve that with your treatment team and your lymphedema specialist. Next question. I had breast cancer and lymphedema on the left arm. I am wearing compression. How long should you wear compression per day?
That's a great question. So, and I know Kirsty mentioned that, she had a patient that really only used her compression when she was gardening, when she was flying, and when she was exercising. And with early stages of lymphedema, like stage 0, stage 1, you can kind of pick and choose the activities that may provoke the lymphedema and use the compression there. But when you're moving beyond those stages, I definitely recommend to wear the compression most of the day, if not all of the day. I will say that there is a difference between daytime compression and nighttime compression. So if it's a daytime arm sleeve, I would recommend wearing it, from sunup to sundown. Now, whether
Right.
you have a nighttime garment, then I would recommend switching it out. And if you don't, then I would just recommend taking it off at that point, because there are some risks with wearing a daytime sleeve at night. They're not really indicated to sleep in. It can create a tourniquet and can be a little bit unsafe.
Right. And that's exactly, again, it's a little bit of trial and error dependent on your stage of lymphedema. Okay, questions are coming in, Katie. I am 2.5 years post mastectomy and have stage 2 lymphedema. I do my exercises, walking, and use compression garments for my affected arm and hand. Can chest wall muscle spasms be caused by lymphedema?
I would say not necessarily. You may just have some tightness from other aspects of your treatment, especially the surgery. I'm not sure if you've
Scar
had
tissue.
radiation.
Yeah. Right. Yeah, scar
So-
tissue. That would be one I would definitely discuss with your treatment team, your medical team. I have seen scar tissue in the chest wall sort of back up an arm or a breast, or I know you have 2. But it's unlikely that I would discuss that one with your medical team. Next up, also my lymphedema started in my left arm originally after an accident. Right arm cancer side is now my good arm. Just feels like my, oh, okay. This is an addition to the last one, I believe. So is now my good arm. It feels like my swelling moves. Okay. I think that one's saying that they feel like the swelling has moved within their arms. And I think we could speak to, depending on treatment and, which lymph nodes were just dissected and which areas are radiated, we can see. And have you ever seen it, Katie, where we're expecting it somewhere and it might be a little in a different place?
Yes, and I mean, everybody's unique, but when we think of lymphedema too, we do think of the watersheds. And the watersheds create like a territory. So generally the lymphedema won't really cross that watershed, but I'm not going to say that, everybody's unique and there are unique situations, but it's not likely that the lymphedema is moving. You may be just noticing swelling from other aspects of the injury. That one's a little bit more complicated. We may need to.
Yes, again, it sounds like definitely discuss that one with your medical team. Okay. Oh, we got a long one with lots and lots of questions. Okay. I'm going to try and break it down for you. Well, we sort of answered it. Can lymphedema move to other body parts? I mean, typically, if, like Katie just said, if your axillary nodes, your armpit and your breast is where the treatment was, we wouldn't be seeing it related to that treatment in a leg, right? Katie? So typically not. I feel like my feet get swollen while sitting, like when I was pregnant, which I am not. Her back, elbow, and now she's starting to feel it in her stomach. Okay, but there is some diagnosis of some thyroid and weight gain, and they feel like they're getting worse rather than better. And they're curious if the thyroid meds are making the lymphedema worse. I know that was a lot of question.
That's a lot of a question. I don't think that the thyroid medication will necessarily make the lymphedema worse, but you can talk to your endocrinologist about that. But what I am noticing that you mentioned that you've gained weight, and that that may be putting more strain on the lymphatic system, and that may be why you're seeing more swelling in your involved areas. As well as, having increase in your weight will put more strain on your venous system. So that may be why your feet are swelling, especially, if you're standing on your feet a lot or more active.
Right. So I would 100% agree with that, Katie. That we think, and part of the thyroid treatment or diagnosis is the weight gain related to that. It can only be a couple of pounds, and we will see a change in a lymphedema presentation at times. So that's why we're so big on exercise and getting ahead of it, because I think you said it very clearly. The sooner we can help you manage your lymphedema or your risk of lymphedema or reduce your risk, likely the better outcome. Correct, Katie?
100%.
Yeah. I am mindful that we're getting close to the end of the hour. I have a final question, and then I'm going to let everyone know at the end when our next presentation is. And if you wanted to rewatch this video, because there was some really great information, it is on our newly updated website. So what can we do every day to help with fatigue? We said exercise. Any supplements that can help?
I can't necessarily speak to supplements, as I'm not a medical professional, and since I'm not a medical doctor. I'm sure there are supplements, but I would definitely recommend talking to your medical oncologist and physician team about those. But in terms of managing fatigue, especially as an occupational therapist, we look a lot at routines and sometimes taking a close evaluation of the activities and the goals that you have for yourself and how we can help you to manage them. In terms of setting up a schedule to help you to maximize the times that you have the most energy can be very beneficial, as well as helping you to implement a routine of exercise. When we think of exercise, we think of stretching, we think of aerobic components, we think of strengthening, but also just, having a good, healthy routine and helping to balance the activities. Sometimes we create like to-do lists, and sometimes we just have to create a today list, and kind of spread out our activities and think of how we can conserve our energy and really maximize our impact.
I like to tell patients, Katie, you start the day with a certain amount of gas in your tank. If you use it all by 10 a.m., you are out of gas, right? Yes. So you need to plan and use it on things that are important to you or absolutely have to be done. Okay, I promise this is the final question. How often do I need to see my lymphedema therapist?
This is a great question. So, when I'm working with people actively in treatment, I see them generally 2-3 days a week. But then beyond that, I usually like to see the patients at different checkpoints. So, maybe initially I might have them come back a month after we finish our treatment, just to make sure that everything is going well. And then after that, we might spread that out to every 3 to 6 months, especially when we think of the garments and there need to be replacements, especially if my patient requires that. I like to try to see them before that, just to make sure that, whatever they're going to be replacing their garment with, is going to fit into work for them.
Right.
But, it can be unique given the patient's situation with work, insurance, and things of that nature. But I would say every 3 to 6 months is across the board would work.
Yeah, and generally, insurance covers lymphedema therapy dependent on your insurance. But it is just like if you had your knee done or a hand injury, lymphedema treatment is related to that. It's provided by physical and occupational therapists, and ReVital checks benefits before we get your patient scheduled. So Katie, it was always great to discuss lymphedema with another lymphedema specialist. I really appreciate your taking the time to talk to all our participants today. And that Katie's wonderful presentation is going to be stored on our newly updated website, so you can rewatch that presentation or any of our past presentations. We have different topics on the website. Fatigue, cancer-related cognitive decline, what is cancer rehab? So we have all our past presentations on there as well. Our next Living Well Beyond Cancer will be June 13th. How Cancer Rehab Helped Me. It'll be a panel discussion with some of our wonderful cancer survivors or those going through treatment. So I always look forward to those presentations. If you have any questions, you can go to our website, or you can even call 844-473-8485 to speak to a ReVital therapist or find a cancer rehab specialist closer to you. Please be sure to follow us on social media for more inspirational stories, resources, and upcoming events. We hope you enjoyed today's presentation, and we look forward to helping you live well beyond cancer. Thank you.